There's several different types of hearing loss that a person might suffer from. The two main types are called conductive hearing loss and sensorineural hearing loss. A conductive hearing loss occurs when something in the outer ear or the middle ear is preventing sound from getting to the inner ear. This could be wax in the ear canal, a foreign object obstruction, swelling of the ear canal, or fluid behind the eardrum, an ear infection, a hole in the eardrum. These are all things that can be treated medically, and we make a referral to an ear physician to evaluate and treat those conditions if we can't deal with them here in our office. The second most common type of hearing loss is sensorineural hearing loss, and this is the type of hearing loss we deal with the most at Audicles. Sensorineural hearing loss is due to damage of the inner ear or the auditory nerve. This is something that cannot be treated medically with pharmaceuticals or with surgery. We use hearing aids to amplify sound, to drive the inner ear system, and hopefully provide a great deal of benefit to people who deal with sensorineural hearing loss. Once a hearing loss becomes more in the severe to profound range, we might make a referral for surgical intervention for something called a cochlear implant. There is another type of hearing loss that we're seeing more and more in children due to a condition called auditory neuropathy or dysynchrony. This condition occurs when the auditory nerve doesn't fire synchronously, and so the person will sometimes hear sound quite normally and then sometimes seem to suffer from a really severe hearing loss. There's a number of different ways to treat this condition, including hearing aids. The last type of hearing loss that we see pretty commonly asked about is called an auditory processing disorder. That's not necessarily a physical hearing loss that we can measure in the sound booth, but it's a different way of processing sound where the person perhaps has very normal hearing, but once they walk into a noisy environment, can't seem to understand anything going on around them. Or in a classroom, a child cannot focus on the teacher no matter what accommodations are made. It's a more complex situation, and we do make a referral to a different audiologist who specializes in that. However, the majority of hearing losses can be treated either medically or with hearing aids, and we are happy to evaluate anyone and help them make a decision about where to go next.